Hello, everyone. Today is my lucky day introducing you with one of my very old good friends, Dr. Rohit Punga. I always call him as a celebrity oral and maxillofacial surgeon practicing with more than 15 years of experience. He's HOD PhD MDS guide in Sharda University, visiting consultant as a maxillofacial surgeon in almost all top shot hospitals in Delhi NCR and is specialized into not, you can say, what not in maxillofacial like craniofacial trauma, face deformity surgeries, lip, cleft lip, palate surgeries, rhinoplasty, genioplasty, TMJ joint. I am getting short of words actually. Welcome, Dr. Rohit Punga. Thank you for accepting this kind invitation.
Hi, Dr. Amit. How are you? It's been good time and long time. Always great
So,
to connect back to you.
without wasting time and of Dr. Rohit, he's a busy man. He's not in Delhi, and yet he agreed for this interactive session. So he's going to talk about the scope of oral maxillofacial surgery, what you guys who are going to enter into MDS, MFS, what you are going to do in MFS, what is the scope beyond that, all on you, Dr. Rohit.
Thank you so much. Thank you so much. And that gives me a lead to very straight away go into the topic that, maxillofacial surgery is a different kind of domain of dentistry. And as we know that many countries serve it as a dual degree program with MBBS, and some countries serve this as a non-dental program, and some countries serve it as a dental program, as a as a specialization after dentistry. Well, the more important thing is not that how you are trained. The more important, the more important is how you are trained rather than what is your qualification. Once you are into maxillofacial surgery, life changes quite a bit when you come out of a dental program only like ours. So the amount of hours and the amount of time that you will need to invest in oral and maxillofacial surgery is going to be proportionate to the kind of success that you achieve. If you compare yourself with other specialities, sometimes you may feel a little jealous that they have a little easy life than you guys have, although my friends in prosthetics are working equally hard like I do. So it's not about the what exactly you are doing during your post graduation is actually going to decide what you will be doing after your post graduation, and learning is going to be a constant process in maxillofacial surgery. When I say that, I would want to just emphasize one important thing which I have found, which has become a little lacking over the years. When people earlier used to get into maxillofacial surgery, they were much committed to, picking up things in general medicine, general surgery, learning from the other specialists, collaborating with others, and working. Of late, I have just made a general observation that I feel people want a little bit of an easy life, maybe, but they want the complete success. Now, that is against the old dictum of no pain, no gain. And I believe that the scope of maxillofacial surgery is actually the highest amongst all the dental specialties, as I see it, because the kind of variety of work that you can get to do is never going to get you bored in your profession, at least. So, we have a great scope in maxillofacial surgery, starting from basic minor oral surgery to implantology, to advanced implantology, to trauma surgery, to dentofacial deformities, to cosmetic surgery, to, oncosurgery. Aesthetics is there. TM joint specializations are there. You can get into arthroscopy. You're legally allowed to do all this work as long as you have some kind of training behind your credentials, and you are exposed to these kind of things because they're all covered in the curriculum. If you pick up the MDS 2007 or even the MDS 2017 guidelines from the Dental Council, you will find that there's a huge list of procedures that you are legally allowed to do, provided you have the exposure to these kind of procedures. So what is important in choosing where you do your maxillofacial surgery is that you choose institutions which give you better exposure to surgery. You choose institutions which have good guides, which have good infrastructure, which have a good patient flow. And a friend of ours, Amit, and I have common friends. So I will just quote him. We've not taken his permission, so I'm not going to take his name. But he told me that, Rohit, when you're going to choose, a college for yourself, just go and visit these institutions personally and see, talk to the students there, talk to the postgraduates there, and you will find out the real picture. So I did it, and I literally landed up in one of the best institutions in the country myself. But I would not say that you can just choose institution on the basis of what people say. I would just doubly recommend what he said, that you can actually go out and see what actually is happening in these institutions. So when you go there, you will find out that certain institutions will not have very frequent operating room visits from the postgraduates, which would not be a great thing to have as a maxillofacial surgeon. As a maxillofacial surgeon resident, that is postgraduate trainee, you should be entering the operating room at least twice a week. You must see institutions which are having 3 to 5 days of operating room visits of the postgraduates. Sometimes what happens is that there are a lot of postgraduates in a particular institution, like you may have 6 or 8 or 10, and the proportionate operating rooms may be just 3. And you may have a place where just a single unit is running and you have 2 or 3 operating room visits. So the opportunities that you get as a postgraduate are proportional to the amount of cases that you are going to see personally. It's not about whether your unit is doing 1,000 cases a year or they are doing just 300 cases a year. If you yourself are able to be part of about 100 procedures a year, then I would say that you are doing relatively okay. Although there's no benchmark. I mean, I personally had about 200 cases plus in my post-graduation. But seeing the situation of most of the institutions after that, I feel that if you've done about 100 cases a year as a postgraduate resident scrubbed in, I think that's a decent amount of training that you've received from a postgraduate point of view. And when we say the scope is directly proportional to the kind of exposure that you're going to get. If your institution that you're going to choose is doing only trauma surgery, then when you come out and you're offered cases like cleft lip palate or facial deformities or oncology, you will obviously feel scared. It's natural. So for that, we have from the association, we have a lot of fellowships which have started these days. And you can just go and attend one of these fellowship programs for about 2 years. Most of these specialties fellowships are there. We call them subspecialty fellowships because they are meant to enhance your training in areas where your institution was lacking. So certain institutions will offer you the full scope. Like, again, I will not take names. You can just go and find out. There are many institutions in India, I would say about 10 to 20 beautiful institutions in India, which serve you with every single little subspecialty training, as in you will be able to attend the operating rooms of trauma surgery, of orthognathic surgery, of oncology. You'll be able to attend implants. You'll be able to attend some kind of aesthetic work, facial rejuvenation work. You'll be able to attend TM joint surgeries there for internal derangement, for ankylosis, for joint replacement. So there are institutions which are doing a phenomenal amount of work in India, and they are training their postgraduates really well. So when you are, running in the top ranks, I would say that you should make a choice of a good institution, depending on what kind of work is being done there, and especially if the institution has good teaching quality. These are two separate things. Many times there are institutions which are doing good work, but the teaching is not so good. And there are institutions where you have very good teachers, but the work is not so good. So you have to strike a balance between the two. I would also request students not to really, focus only on that which institution is closer to their place and these kind of things. You should always be a resident, and a true resident means you should stay on campus as an oral and maxillofacial surgeon, postgraduate trainee or a resident. So because you will have night duties, which is not going to be there for any of the other specialties. My own postgraduates, they have a night duty every other, if they are 3 postgraduates, so obviously you have 10 night duties a month. So it's on a rotation basis. So 10 night duties a month means you can't afford to go and come back and then go and come back, because many of my residents are it's a very routine for them. I'm not praising them or anything. It's their job, and I believe that it's the job of every postgraduate in maxillofacial surgery to do that, because if you want to achieve something in life, you have to actually go see patients at the casualty middle of the night, 2 o'clock, 3 o'clock. And these kind of things are possible only when you're in the campus. You're well connected in your campus. Your people know you well. When you go, it's not out of surprise that, oh, where have you erupted from today evening? I have never seen you for the last 2 months. So that kind of thing will always keep you at the back end. So your connections with your fellow friends in the medical fraternity, because the hospital will have all the medical specialties running, because that's the way oral surgery post-graduation is there. If you don't have a hospital medical college alongside, then obviously your training will not be good. because you need to get exposed to your fellows your fellow colleagues in anesthesia, in general surgery, in orthopedics. And we have all specialty postings, like our postgraduates go to a cleft posting, they go to a oncology posting, they go for a general surgery posting, general medicine posting, they'll go for a neurosurgery posting, they'll go for an anesthesia posting. And of course, casualty is not a posting for us, it's a rotation which goes on every month till about 2.5 years in my unit. So like that, we guys are all across India. The curriculum has been designed by the Dental Council, which has been followed, and all the good institutions are following it verbatim. So I would say that if you look at what you're going to do out of your post graduation, then it starts from
that is one big concern. I'm sorry to interrupt. It was a
no,
great listening.
please do, because I will just go in the flow.
Yeah, that's what I realized, and taking liberty because you are a dear friend. So
Of course,
interruption in between, but two things. Like one, you mentioned about the DCI going into many procedures which are legalized now for some specialties, especially like maxillofacial surgery. I remember you being conducting one workshop on facial aesthetics and hair transplant recently.
yeah,
I had
yeah.
also requested Sir, Dr. Rohit Sir, I want to attend that, and his reply was very prompt and firm, like his, you can say, conviction when he's doing surgeries, that you are not allowed. Even though you are a
I didn't
friend,
say
but
that
you
to
are
you,
not
that you are
allowed.
not allowed. I just humbly put it across, Amit, these
No,
things.
it's like really good. See, I take it as
You can
a, you
pull my
can
leg,
say,
yeah.
yeah, it is a good part. We both come from a background, we have little high on ethics and all that. So, uh, these hair transplant and all, like, can you throw some light? Like nowadays, I think it is allowed with maxillofacial only, like
Yes.
we had this discussion.
Yes, if you have exposure to hair transplant during your training program, because now earlier it was not there in the curriculum. Like
During
when
means during the MDS or can be done after also.
both ways, both
Okay.
ways. It's for all subspecialties. For example, uh, I will not pick up a topic like hair transplant because it is relatively newly inducted into the curriculum, relatively just a couple of years back. I will pick up a topic like which is old there and nobody touches it very easily, which is my favorite topic, that is facial deformities, orthodontic surgery. So you
Rhinoplasties
have
and
so
all
many
that. Yeah.
institutions. Sorry.
Rhinoplasty, genioplasty, and all that. You
Yes,
had
we
been
have been doing
conducting
this for
workshops
like
on that.
quite a
Yeah.
number of years now. And
Yeah.
if we go back to the time when we were getting trained, although my institution offered all these things during my post graduation, I had friends in other institutions who did not have exposure to these things. And then they went ahead and they did, fellowship programs, and they got themselves trained in these things, and then they are doing well. So it's just about that, whatever, as I said, if your institution per se is not offering you that particular subspecialty during your program, although as per the Dental Council of India, most of the institutions have a small quota which you should offer. And orthodontic surgery is something that even in orthodontics there's a quota, and surgery there's a quota, so you should offer. And of course, if unfortunately there is some kind of lack of exposure in any institution for that matter, we have a lot of fellowships which have come out now, and our own association. I'm a member of I'm an executive committee member, so I can say that with a lot of pride that our own association has started a lot of fellowship programs, and these fellowships are actually empowering our fellow friends and the youngsters who are coming out of institutions where they could not get a particular kind of exposure to get themselves exposed with formal training, and then they are more than competent to go ahead and do the work that they really desire to do. So sometimes it does happen, you get a rank which is not so good, but always remember, do not change your specialty, because your specialty should be your passion. If you are following your passion, you will find a way. But in case you choose your specialty according to, okay, this is not so good here, and I will go in for a different specialty because this looks okay here, so then your life will be governed by that particular specialty.
Yeah,
And
that's
if you
a
want me to look at
common
the
scenario amongst many students.
yes,
Yeah.
this has been the time. I mean, you dropped seats in All India. I remember you got through before me, so I remember you didn't take a specialty because you didn't like it.
See, it was like, I would say, ignorance or lack of conversations like these, which were not happening those days. And we coming not from medical dental background, we didn't have any update on such things happening across the country. Forget about that. It's not about me and It's more about you and surgery. So now the question is like once an oral maxillofacial surgeon MDS after 3 years of her rigorous training passes out,
Yeah.
what is the spectrum? Like how good or bad is the scenario in today's time? You being into surgery since 15 years, I know you doing what not at all levels, clinic, big hospitals, small hospitals, biggest of hospitals and institutions. What do you think? How the struggle part goes by? Like, should he or she should be worried about monetary gain immediately, or will he get exposure of small surgeries or big surgeries? And just maybe imagine yourself, you just pass out in today's time. How will
Okay.
that oral surgeon make his or her path towards glory?
So if we look at the situation of small surgeries, I think most of the maxillofacial surgeons who come out with an MDS degree are reasonably competent to perform minor oral surgery inside the mouth. I don't doubt the competence of my fellow friends who are going to pass out and who have been passing out recently. Most of them I've found that they'll do very good third molar surgeries. They'll do good implantology. They'll do good minor, like buccal fat pad reconstructions for closure of small fistulas here and there. In case you get stuck with a bad, tuberosity fracture, they repair it well. In case, I mean, all the things that can be done inside a dental clinic. Most of my, known postgraduates who I have seen in the last couple of years, when they have cleared, they've been able to do that. And the things where you get stuck sometimes is the higher surgery. Now, higher surgery starts at two different levels. If you want to think that you walk out and because of somebody and jack and pulls and pushes and somebody known here and there in a big hospital you'll get through, well, you may get through, but then the point is going to be whether you're competent to perform that particular surgery or no. So I was a very unconnected kind of a guy, as you know me very well. I will just tell you a very small thing. I went into this one big hospital in when I cleared, and I asked them. I said, "I want to do this surgery. I'm exposed to this, and I will walk into your rooms, and I will work under the mentorship of a senior surgeon or whatever. But I want to do these surgeries here." He said, "Sir, we have a very simple philosophy. We do not allow anybody to work before they have 3 to 5 years of experience, because that is when you can perform your independent surgery." So that was a pretty straightforward answer, and I am very happy that he gave it to me right away. Because had he been keeping me under the dark and stuff, I would have not been able to make my mind. I still did try, because we're all kind of going on. We are not quitters, so we keep trying. And when we keep trying, we hit the right nail sometimes. So what I did was I told him, I said, "Okay, fine, point taken. So I will return back to Delhi when I'm with about 3 to 5 years of experience, because I knew that if you don't let me operate, I will not have experience. And then you'll tell me I don't have experience because I've not operated." So I realized that if I want to have experience, it should not be just number of years of experience. It has to be actual working surgical experience. So then, what you can do is the bigger cities in the best of corporate hospitals, and they have a policy because they're maintaining quality. So, they are all maintaining quality assurance cells, and all these things are important for them. And I think that's the right way also, because if you just come in and give a chance to anybody who's fresh, you may land up with problems. And of course, anybody who's charging good amount of money from the patient will not want to do that. So I respect their policies. And I think we all must work up to come up to a level to serve our patients in a way that, we are predictable in our surgeries. And how do you become predictable in your surgical outcomes? That's through gaining experience. That's through doing more surgeries. So you find out places wherein they don't have these kind of eligibility criteria that, you must have 5 years of experience, only then we will let you operate. So you will have to find centers, smaller centers, rural
Move out of
centers,
main
suburban
city.
centers, yes, wherein the people need surgeons and they are not even getting basic surgical access to a maxillofacial surgeon. And there are a lot of places in India. We have a 150 crore population with number of cities. So find yourself a place where you can hone your skills and serve the people in an ethical manner. Because when you are not under the eye of the camera, you are always under the eye of the upper camera. God is always watching what we do. So don't think that if somebody is not watching, nobody's watching. He's always watching. So the ethical practice is absolutely in your hand, and I think there is no need for any strict guideline actually for an ethical person to practice wherever you go and practice. But the important thing is that you must keep on doing some work regularly so that your hand keeps moving, so that you are experienced by those. Yeah.
Can
So
be
the
minor
research
surgeries
has to be
also
invested
that
well.
can be. Those can be like keep on doing some work, like minor
Yes.
surgeries or implants or
Minus
something.
yes, there was a time when we used to think that until unless we do major surgery, we are not doing justice to our profession. Well, that's a very strong point, and I still believe in that. The point is that you will not suddenly get a onco surgery the moment you come out, because there are enough onco surgeons in the country from different specialities who are serving the same region. Head and neck surgeons are not less in this country. There are enough. So why would you get a chance? I am already doing orthognathic surgery in my city, in different places around my city. Why will a new person get a chance? So if you start thinking like that, then you'll probably not do anything. For that matter, there are enough people practicing third molar surgery in implantology also. So then why will you get a chance to do that also? So that's an ongoing process. It's a dynamic. It's a dynamic thing which will always, the new people will keep adding into the system with their competence and their
Make
skills.
space for
So
themselves, like with the good
yeah.
work and the
Yes, yes. So the starting times can be small. You can have humble beginnings, but you should have perseverance. That's
humble
the most
beginning
important
means
thing.
like one common question which usually our MDS aspirants ask me a lot, and I'm not very sure of the answer. That's why I invited you for this. How much, like you say, the struggle comes, I'll rephrase it again. The monetary gain part after MDS, is it like going to take months and years to start settling down, or it's not that bad how the people look at it?
It's a very subjective question. When you say settling down, I have people like when I got my first job, I got it for about 35,000 rupees as a lecturer. And then I used to move around into the city doing third molar surgeries and stuff to make about 40, 50,000 rupees to sustain myself in a city where nobody knew me. I had to pay for my rent, I had to pay for my food, I had to pay for my travel, etc., etc. And I was okay with it. But today the aspirations have gone high. People are not going to be happy with 30,000 rupees. There are people who tell me, sir, this is not the kind of this thing. So I tell them one thing: if you have higher aspirations, you have to work harder, find more clinics to consult, do more work, and earn more money. So when you say settling, you can settle down with a minor surgical practice, you can settle down with your own dental clinic. But then how is that clinic going to come? Is your dad going to fund it? Do
The
you have
clinic,
a dental clinic
one
running? You know?
does an
So,
common question, how good or bad is the proposition oral maxillofacial surgeon opening his or her clinic immediately passing out of MDS?
yes, my
The
friends have done it.
major questions come as like he or she, will he be able to do RCTs, justice to restorations, prosthetic work, and whatnot? You know how a dental clinic looks like.
Okay. I will be very truthful in this.
Yeah, that's what
I had
we have
decided,
invited you
I
for.
had decided after my MDS that I would never do a dental procedure in my life after this. I was very sure what I wanted to do. But life is not all what you want. So sometimes bad times come and you do not get what you want. But at that point of time, what will hold ground for you is your skill, your knowledge, and you can actually start like a phoenix from zero at any given point of time if you have your knowledge and your things right in your head. So there comes, I mean, there comes times, difficult times for everybody. The difficult times come for everybody. And having said that, I will just give you a small example. As I was saying, I was compelled to do a root canal procedure after 9 years of not doing it, and I did well. I read up Grossman back because I had done root canals as a tutor when I was working. I had done root canals as an intern. So all I had to do was go back and read the same books and say that, okay, fine, what I used to do 9 years back. And I did two root canals, just two, in the last 15 years. And in fact, I've just done two root canals in the last 18, 19 years. So
And today
and
you
both
are
of them were successful. In fact, one patient called up after 5 years saying, my other son also has a root canal. Can I get it done? I said, no, you please get it done from someone else.
because
Because
today
now I
Dr.
maintain
Rohit
a specialty
Punga
practice.
is running exclusive maxillofacial and dentofacial
Yeah.
aesthetic practice in Gurgaon.
Yes.
And one of the like rare sites, like where maxillofacial people running exclusive maxillofacial practices, but yes, he's a legend, so he's definitely doing it.
No, there have been
So
people senior to me also who have done it. I will not take all the credit. There have been precedents for me. There have been senior
I
people
know
before
very
me down south.
like hardly one or two. Like
Yes,
that's why
few of them. But yes, they are doing.
very few.
So Yes.
So coming back to this, like another thing which like I don't know how to ask or phrase this, but yes, very, very common question. I'm asking only because on students' demand. Does the surgery has a predilection for boys? Right? Is there any gender bias in the maxillofacial world?
Oh, no, 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 no. It used to be at point of time, maybe, but I will tell you, I can actually name three ladies who I know of from different specialities of surgery. You said maxillofacial world specifically, but I'm going to talk about general, I mean, surgery in general. The lady who's taught me oncology is a lady. The lady I first worked under, who I observed flaps, was a lady. I mean, a plastic surgeon was a lady. And I have friends in the maxillofacial surgery fraternity also who are ladies. And trust me, they're doing very well. There is nothing like a gender bias. In fact, I feel that it's more of a reverse gender bias. I feel left out because nobody's coming to me. Everybody's going to the ladies. That's
See,
just
like the thing is, maximum rankers, the BDS as such has a little more number of girls into the profession. Rankers are majorly more of girls. So, like most of them, like in today's scenario, rather today, I would say last 5, 7 years, oral surgery is in huge demand, especially
Mm.
among the top rankers.
All right.
So, the girls who wish to take oral surgery at some point of time, maybe like the thing is they cannot roam around into different clinics for consultation because of little limitation, or maybe after say settling down into marriage and all. Does it really make a difference in long run? Like all these factors. Like you clearly
I
said,
don't
there is
think
no
so.
gender bias. We agree, but you have been into the industry for last 15 plus years. So long run make girls and boys doing great according to you and your
Yeah, I
observation
mean,
and your
I
experiences.
feel it's not about girls and boys. It's about the amount of dedication that you can give to your fraternity. That is more important. So how, in the Indian scenario, people see it as that probably a lady after marriage will probably not be in a condition. But then it's the problem of the guy she's staying with, because he may be asking her not to do justice to her profession. So I
That's a big relief, I believe, like when listening from the experts in the field, like there is no, as you have heard it rightly from Dr. Rohit, there is no gender bias. So all the top ranker girls who are desperately becoming like entering into the world of surgery, be very confident, be very sure, like he said, become the best surgeon, then no way you are going to be any, you can say, no difference actually. It's like all in the mind, nothing else. So
In
Dr.
fact,
Rohit,
so
one,
far, how many,
yeah.
in fact, how many ever students I have trained till date, the best postgraduate who I have, who I consider has been my best postgraduate in the last number of years, is a girl.
Has to
And
be.
she's doing well.
Yeah.
She's doing well.
See, it's always, it should have been always like either ways, both are individuals. Whoever learns best, does the best, performs the best, is going to be performing better in life as well. Back to
Absolutely.
the topic
Absolutely.
of passing out of MDS, like there is a lot of, you can say, hiccup when we listen to the stories that when I pass out of MDS, will I be like expert in all the procedures which I have learned in the college? Or
It's not possible.
that my degree will define me after a certain time that I am expert in this or that. Please enlighten on this part.
Yes, yes, yes. As I said, when we start humble. So you can start with small things in different specialties, subspecialties. You can start doing the whole scope of minor surgery mostly. Implants, you may start just placing implants, then gradually you will learn how to plan the implants with your prosthetic friends. Gradually you will acquire more knowledge, you may attend workshops, etc. You will understand how to preoperatively evaluate implants. You will understand gradually how to do sinus lift procedures, bone grafting, etc. That depends on whether you've seen anybody do bone grafting, onlay grafts, direct sinus lifts. If you've seen this during a post graduation, the curve becomes easier because you've seen it, you've assisted it, you know exactly what is to be done. And then it's just about putting your hands into the same thing with relevant amount of knowledge. So that's for implants per se. So even a thing like implant, which people think, okay, fine, I am a surgeon. What's the big deal in placing an implant? I think placing an implant is a big deal if you do it the right way. Placing the screw is not a big deal. Placing the implant is a big deal, because that implant has to stand on strong and sound prosthetic as well as periodontal principles, and it has to serve a good number of years with load bearing of the mastication. So that has to be properly planned. So even things in minor surgery, you don't suddenly start doing everything in a day. You gradually acquire skills as you keep doing work. In trauma, you may start doing mandibular fractures as the basic thing, symphysis fractures. To do a little more difficult surgery like an angle fracture, you may need to do a couple of symphysis fractures, and then you become comfortable with the training systems, etc. And there's some institutions who give you more of hands-on exposure, so their growth is a little faster. But ultimately, if you see them 5-10 years down the line, it all buffers down, because the people who are coming out of institutions where there's not much of hands-on experience, they will have more knowledge on experience sometimes. That's my observation. So, like I did not have a lot of hands-on experience in many things, but I had certain hands-on experience in certain things. So the growth somehow buffers down after about 8-10 years, because where you know your lacunae, basically. You have to cover up your lacunae to see how you grow. If somebody says that I will start doing a particular kind of surgery after 5 years, he has already sorted out his head that I will do this, and then I'll be performing the surgery. And there will be things that you are left out after 5-10 years also. You can always go ahead and train yourself in those things and start doing those procedures whenever you want. There's no age to learning. There's no age to learning. Whenever you feel like that certain things are being, you are feeling deficient. So instead of just doing something in the surgery, it's better to go and get trained and come back and start doing that surgery. So there's no age for learning. That is one. And when you say that, when will you call yourself a maxillofacial surgeon? Of course, after the degree, you can call yourself a maxillofacial surgeon, but take up procedures as per your own competence. Or you can always invite your senior friends to collaborate and work. That's a very good way that I've seen some people who started working. Like, they'll call their senior. Like I have younger colleagues who call me at the table sometimes. And we collaborate and we work and do well. So that's a good thing. That's a very good thing, because this keeps you in the profession, keeps you in the profession, in the business of the profession as well, because you're getting some money, you're making some good work for the patient, and you're not doing it the wrong way because you have somebody who's a little trained, maybe better than you, and ultimately even you will come up to his level, and everybody starts operating on their own with time. So it's a process. It's a process. You have to go step by step. You can't jump the gun overnight, because you can't learn skills overnight. You don't lose skills overnight. So whenever
Regarding
you are
implants, like since implant is divided into surgery, prosthetics, and perio part, when an oral surgeon, say after passing out or even during the post-graduation learning part of implantology, he is like supposed to learn prosthetics also, or is it taken for granted that since you have in curriculum, so you will do implants very well?
No, as I said, a degree is no validation of the fact that you can do a particular surgery. A degree only legally empowers you that if you have the relevant exposure and skill, you can perform it well. If I have an MDS from XYZ college, which did not give any exposure, and my friend has an MDS from another ABC college, which gave him a lot of exposure, you can't compare the two postgraduates saying that, both of them can do the same procedure. So it depends on the exposure. That's why I say go to a good college. That's very important. Go to a college which covers a lot of scope of surgery and puts you into different things. Like wherever they are deficient, they may put you into that particular peripheral posting for that time. And peripheral posting is actually a part of the curriculum, but certain people have introduced some special postings when they feel that their postgraduates are not doing so well in that particular field, because they are probably doing lesser number of cases of that particular thing. So they put more peripheral posting. So you have to go and talk to the postgraduate and see that what you want, is that what you're getting. I have friends who just do implantology. I have friends who just do implantology in minor surgery and maybe very basic trauma work. They're all maxillofacial surgeons, but then they know their limits. They will not take up orthognathic surgery and start doing it suddenly because they have an MDS in maxillofacial surgery and they have about 10 years of experience. They have 15 years of experience. So that is relevant to your own work ethic. There's what work you can do. If you ask me, as long as I'm not doing a full scope, within my hearts of heart, I still don't feel I'm justifying my degree. So that's an individual preference, and me very well. So
Your
for
own
me,
case scenario, like you also, did you also undergo the training in implant, prostho part or perio part or something? Because surgery was done. What about the
I
other two
traveled to
components?
I traveled to the US twice, actually to learn from periodontists. I attended the Global Implantology Week at NYU. Then I was there for the Morris Salama's,
I
what he
remember
does
that.
in Atlanta XP thing.
The
So I've been there,
greatest
and
person
I
on
think that was
right here.
wonderful training. Yeah, they had hands-on workshops. I've attended subepithelial connective tissue grafting hands-on. I have attended Cori plate technique.
It's a
I did about
lifelong learning curve. You have to keep
yes,
on
yes,
enhancing
yes.
it, like
So I learned it from
refining your skills.
periodontists because I think that training is very much lacking in our country here. Whereas in the US, if you see, there's so many people who are doing excellent periodontology and implantology combination. Here in India, I've found my friends, if you tell them, oh, what is there in periodontics? I think periodontics is an amazing specialty. When they look at the tissue, they know whether the implant is going to live for 10 years or 20 years. You look at the experienced periodontists. I think you know a couple of them, being your teachers also in GDC. I
So,
think we spoke about that. Yeah, so they are international faculty to these programs there.
so we
So
are all
of
like, there
course,
is a loud message here coming from Dr. Rohit also. Once you pass out your degree in maxillofacial surgery, MDS, it's not the end of learning. You have to keep on upgrading. If I
no, it's
may
the
ask
starting.
Dr. Rohit
It's
what
that's
he
where
is
you
doing,
start learning.
why you are not in Delhi right now, and what you are up to for last 2, 3 days. Can you just,
Not two,
after
3 days. I'm
15
for the
plus
last two
years of
weeks, and
experience, listen to him what he is doing now?
yeah, I've been here for the last 2 weeks. I'm not going to disclose the place and stuff. It's a
Yeah.
little so, yeah,
Learning
I'm enhancing my skills in surgical
skills in
oncology. Yeah. I'm still because I'm not doing very active oncology, and I'm feeling deficient because I've attended RCC Trivandrum. I've attended Tata a long time back, Tata Memorial Hospital also as a junior. This thing. But now again, I have assisted in between. I started doing oncology, and then I found myself a little restricted in certain areas of oncology, and here I am sitting for the last 2 weeks. I'm getting trained further in surgical oncology, and I'm feeling better after 2 weeks
in
because during my postgrad I had about 86 cases to my log in oncology, but the only thing is I did not start doing it for a long time. So when I found a little deficiencies in my own thing that I couldn't take the whole thing uh, the way I take most of my other surgeries. So I felt that I'm not able to take up surgeries because I'm actually a little very
I
bound
know
with my
you
books.
from last, if not less, 19 years now. 2005 we met,
Yeah,
and after post graduation of his, like most of the time, though we are in same city, but it's difficult to catch him up because whenever I call him, either he's out for some microvascular workshop or some this or some that. Fancy names come up every time, and it's good. I'll tell you, myself, my entire family, anyone who has any issue in relation to maxillofacial surgery, he's the guy we allow to operate on us. And in future also, that is the good part. You can say the trust we have in Dr. Rohit Punga. So it was
that's a
great
lot of respect.
interacting
That's
with
a lot of
you.
respect.
Great. Thank you again very much for giving your valuable time, insight on this specialty. Yes, there is a lot more. I know you can talk for next 12 hours also, like you do spend in your OTs for overnight surgeries. But let's
Yes.
put a little stop here. We'll definitely meet in person and discuss more avenues, opportunities coming up. Thank you again.
Anything for maxillofacial surgery, anytime. It's a
Thank you.
passion I'm not going to leave till I hand my boots.
Pleasure listening to you always.
Thank you. Thank you so much. Thank you so much, Dr. Amit. Thank you.